Today's doctors perform some of the most advanced medical procedures in human history, but centuries ago, your surgeon might also be the person who cut your hair, pulled your teeth, and even performed amputations, all in the same day. This is the surprising story of how barber-surgeons evolved into modern physicians. Today we place immense trust in our doctors. We see them in sterile clinics and vast hospitals, surrounded by advanced technology and years of formal education. They perform intricate surgeries, diagnose complex illnesses, and manage our health with scientific precision. But imagine a time when your trusted medical professional was also the person who cut your hair. From barber chairs to operating rooms, this is their journey. In medieval Europe, surgery was considered a low-status craft. Physicians studied in universities but refused to perform manual procedures. Barbers, already skilled with knives and razors, filled the role, cutting hair, shaving beards, and performing minor surgical tasks. Society was structured differently. Learned physicians studied ancient texts in Latin and diagnosed illnesses based on theories of the body's humors. They believed their role was intellectual, not manual. Cutting into the human body was seen as beneath them. Who was already skilled with sharp instruments? Who did the community already trust to hold a blade to their skin? The answer was the barber. Thus, the era of the barber surgeon began, not trained in universities, but in workshops through apprenticeships. They learned by watching, by doing, and by tending to everyday ailments of their communities. They set broken bones, pulled infected teeth, and lanced painful boils. They were the frontline caregivers for the common person, offering tangible relief when scholarly doctors offered only theories. Barber surgeons offered an incredible range of services. They performed bloodletting based on the ancient theory of the four humors: blood, phlegm, yellow bile, and black bile. A small incision in a vein, often in the arm, and the blood would flow into a special bowl. Alternatively, they might use leeches to draw blood from a specific area. Dentistry was frequent and dreaded in an age without modern hygiene. With tools like the dental pelican and, later, forceps, the barber surgeon would grip the offending tooth and pull with force. The procedure was brutal and without anesthetic, yet relief often followed. Minor surgery was routine, lancing boils, draining abscesses, and stitching wounds. They treated burns with salves and careful dressings. They dealt with skeletal injuries, setting broken bones with splints and bandages. Though they lacked modern anatomy, practical experience gave functional knowledge of the body. Amputation was a last resort, most common on battlefields, but also in civilian life when a limb was crushed or gangrenous. The procedure was terrifyingly fast to minimize blood loss and shock. Bleeding was controlled by cauterizing with a hot iron or applying boiling oil. Survival rates were low, but for many, it was the only chance. Harsh as it was, this was their daily duty. Communities relied on their direct, hands-on care. The iconic red and white barber pole has unexpected origins. The red represents blood, the white symbolizes bandages, and the pole itself, it comes from the wooden stick patients gripped during bloodletting to make veins more prominent. Bandages were washed and hung to dry, often on the very pole, wrapping around it as they fluttered in the wind. The brass ball is thought to represent the basin used to collect blood, sometimes one at the top and bottom. The blue stripe, common in the United States, may represent veins, or simply echo the American flag. What began as a practical advertisement became a powerful symbol, a reminder that haircutting and surgery were once one and the same. War has always been a brutal catalyst for medical innovation, and the era of the barber surgeon was no exception. On the chaotic battlefields of medieval and Renaissance Europe, their skills were in desperate demand. They faced a relentless stream of injuries from swords, arrows, and early firearms. They became experts at extracting arrowheads, musket balls, and shrapnel. They learned the grim art of triage, who could be saved, and who was beyond help. The French barber surgeon, Ambroise Paré, a veteran of many campaigns, transformed battlefield surgery. Gunshot wounds were cauterized with boiling oil, a painful, often ineffective method. When oil ran out, Paré improvised an ointment of egg yolk, rose oil, and turpentine. He found his patients recovered far better. He pioneered ligatures to tie off arteries, a vast improvement over the hot iron. Publishing in French, not Latin, he made knowledge accessible to barber surgeons lacking classical education. The battlefield served as a crucible, testing, refining, and pushing their craft toward modern surgery. As the Renaissance gave way to the Age of Enlightenment, medicine stood on the cusp of profound change. Scientific inquiry and renewed interest in anatomy began to elevate the status of surgery. Figures like Ambroise Paré showed surgery could be a field of innovation, not just crude labor. In England, the separation was formalized in 1745. Surgeons broke from the United Company of Barber-Surgeons to form the Company of Surgeons, later the Royal College of Surgeons. Surgeons aligned with academia. Barbers returned to their original trade. Across Europe, formal training, examinations, and professional standards took hold. Universities established chairs of surgery, taught alongside anatomy and medicine. The barber pole, once a sign of medical services, now advertised only shaves and haircuts. The Great Divide was complete. While barbers remained valued neighbors, their role as healers came to an end, paving the way for the modern surgeon. The 19th century witnessed revolutionary discoveries that transformed surgery into the modern practice we know today. They conquered three great obstacles: excruciating pain, rampant infection, and uncontrolled bleeding. In the 1840s, dentists and surgeons like William T.G. Morton demonstrated effective use of ether. For the first time, operations could be longer, more meticulous, and far more complex. In the 1860s, Louis Pasteur proved that invisible microorganisms cause disease and decay. Inspired by germ theory, Joseph Lister pioneered antiseptic surgery, sterilizing instruments, cleaning wounds, even spraying the air. Mortality rates plummeted. Aseptic technique kept germs out altogether. Sterilized gowns and gloves, sterile instruments, dedicated clean operating rooms. Alongside refined ligatures and deeper anatomical knowledge, surgery became safer than ever. Licensing bodies ensured surgeons were trained in these life-saving methods, creating the regulated profession we rely on today. The operating theater turned from a place of dread into a place of hope. From barber chairs to operating rooms, the journey of surgery reflects the evolution of human knowledge. It all began with the humble barber surgeon, the unlikely pioneers of modern medicine. Remember the long path that separated the blade that grooms from the blade that heals. And how both, in their own way, have always been instruments of care, comfort, and trust.